Hi, I'm Melissa Goebel. I'm one of the women's health nurse practitioners here at Cuyuna Regional Medical Center, and I'm joined with Dr. Rachel Cady.
So I'm Dr. Rachel Cady, and I am a OBGYN practicing at Cuyuna Regional Medical Center. And today we wanted to hit on a topic that comes up often, and that's cancer and sexuality for women. So just being that overall cancer affects in a woman's lifetime about 3 out of 10 women, and women are living longer on average with cancer certainly than before. And so being that having some sort of sex life is important to a lot of women, it's important to address this topic. So we're just going to talk about how people usually present and things that are out there and come up. So, Melissa, when you see your patients, how does this usually come up, or what questions do people usually have for you?
A lot of the women will present with pain with intercourse. They've recently went through radiation, or they have vaginal dryness is a big common one.
Yeah. Okay. So those are probably some of the more common symptoms that I see as well. The other thing too is that they a lot of times feel like it's not part of their life anymore. Maybe that
Right.
ship has sailed. They've kind of, put it on the back burner, and maybe don't even realize that it's possible to continue to have a fulfilling sex life. And so, as far as the reason for so many women having pain following cancer treatment, and we're speaking on a broad sort of spectrum here, it really, I think, first and foremost, to recognize that that if it's important to the patient, it's important to us, and that just because you have been treated for cancer, or just because you might be of a certain age, doesn't mean that it shouldn't be something that's part of your life. And also that pain and burning and misery as far as with your sex life does not have to be the end of the road type accepted treatment.
Right.
And so as far as the reason though for a lot of the pain and that kind of thing, how do you kind of counsel patients about that? Like what types of treatments are they going through? What type of cancers are you usually seeing where that results?
So there's a lot of different treatments that these women can have. A lot of times we'll say, have you tried any lubrication with intercourse? Have you started any vaginal moisturizers? A lot of times, if we can do hormone replacement therapy, or even just a vaginal estrogen cream, which is localized. So a lot of cancer patients or survivors can use that as well.
So some of the more common types of cancers that we'll see patients for that are having pain after their treatment is primarily the female type cancers, vulvar cancers, cervix cancers, uterine cancers, radiation following advanced types of uterine cancers, and in particular breast cancers as well, because a lot of the treatments for breast cancers actually lower our estrogen levels. And estrogen works to keep our tissues and the vulva and vagina area well lubricated and stretchy and healthy. So when there's a deficiency in that estrogen, a lot of times women will experience pain or tearing or whatever. And what really comes up a lot is that when women are completed with their breast cancer treatment, they actually can have estrogen cream or estrogen pills in the vagina as an option for them because it's not absorbed into their blood system. But also we'll use a lot of other treatments like we use vaginal dilators. We really try to be proactive with that as well, particularly if people are going through radiation, to prevent scarring and those kind of things. There's a lot of injections that we'll do, numbing medications. So really I think if there's one sort of take-home message, it's just that, for the 3 out of 10 women that will be diagnosed at some point in their life with cancer, sort of my take-home message for them would be to, if having sex as part of your life is important to you, we want to hear your concerns, and we want to hear what's going on with you and what your goals are, and just to know that there's actually a lot that can be done for that, and it should not be accepted as normal.
Right.
Do you have kind of a take-home message?
I think that's the same thing. We know that these women deal a lot with body imaging, so we can involve psychology, we can involve physical therapy as well if needed, and that there is options out there. Again, like she said, if it's important to you, it's important to us, and we're here for you.